Good afternoon, everyone, and welcome to meeting number 10 of the House of Commons Standing Committee on Health. Today we meet for 2 hours to hear from witnesses on our study of Canada's health workforce. Before I introduce today's witnesses, a few regular reminders for hybrid meetings. Actually, I think we can dispense with the reminders because we have all of our members present, and the witnesses who are appearing virtually have all appeared before. So in the interest of brevity, we're going to go right to our witnesses. We have with us today the Honourable Jean-Yves Duclos, the Minister of Health, and the Honourable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health. Online, we have from the Canadian Food Inspection Agency, Sylvie Lapointe, Vice President, Policy and Programs Branch. From the Canadian Institutes of Health Research, Michael J. Strong, the President. From the Department of Health, the Deputy Minister, Stephen Lucas. And from the Public Health Agency of Canada, Harpreet Kochar, President, and Dr. Teresa Tam, the Chief Public Health Officer. Thank you for taking the time to appear today. We will begin with opening remarks from each of the ministers, beginning with Minister Duclos. À vous la parole pour...
You have the floor for 5 minutes, Minister. Welcome to the committee. Well, thank you, Mr. Chair. Thank you, and hello, dear Sean. I want to thank you again for the opportunity to appear before you today to speak about the main estimates for the health portfolio. As you've said, we are here today, or I am here today, with the Honourable Carolyn Bennett, of course, my colleague, Minister of Mental Health and Addictions, and Associate Minister of Health. And we are virtually accompanied by Dr. Stephen Lucas, who is Deputy Minister at Health Canada, Dr. Teresa Tam, Chief Public Health Officer of Canada, Dr. Harpreet Kochar, President, Public Health Agency of Canada, Sylvie Lapointe, Vice President, Policy and Programs Branch, Canadian Food Inspection Agency, and Dr. Michael Strong, President, Canadian Institutes of Health Research. Let me begin with a few words about the current COVID-19 situation. Across Canada, the pandemic outlook is improving. Infection rates have peaked in many areas of the country, followed by a slow decline in hospitalization rates. After 2 years of following individual public health measures, people in Canada know what to do to keep themselves and each other safe. Now, as jurisdictions across the country are adapting their public health measures and restrictions in alignment with their respective situations, we are collectively moving towards more sustainable management of the virus.
Resourcing plans for the health portfolio. As you know, we tabled our supplementary estimate C on February the 19th. These estimates seek the parliamentary approval of $7.1 billion in new spending. Keeping Canadians healthy and safe has been the top priority for the health portfolio, and these supplementary estimates identify key actions towards this goal. This includes the procurement of rapid tests and therapeutics, funding to address anti-Indigenous racism in healthcare, funding to support long-term care, and advancing pharmacare in Prince Edward Island, among many other important investments. I'm happy to answer any questions you may have about these estimates later this afternoon. Now, I would like to turn my focus and your attention to the main estimates for 2022-2023. In total, we are seeking $14.47 billion on behalf of the health portfolio, which includes Health Canada, the Public Health Agency of Canada, the Canadian Food Inspection Agency, the Canadian Institutes of Health Research, and the Patented Medicine Prices Review Board. Je commencerai par un aperçu des plans de santé.
I'll start with an overview of Health Canada's plans. The 2022-23 main estimates reaffirms Health Canada's focus on providing services that are important to people in Canada including support for long-term care, improved access to palliative care, and safe access to medical assistance in dying. To achieve these and other objectives, Health Canada is seeking a total of $40 billion. As you know, COVID-19 has exacerbated existing mental health and substance use challenges for people in Canada. My colleague Carolyn Bennett will provide details on the investments that address these challenges.
Canada for 2022-2023 proposed a total budget of $8.49 billion. This proposed spending will help ensure that PHAC has the resources in place to continue to deliver on its mandate to protect the health of Canadians during the pandemic, including for the procurement of boosters and therapeutics and the continuity of PHAC's pandemic response and recovery. L'Agence canadienne d'inspection.
The Canadian Food Inspection Agency protects people in Canada against food safety risks, supports the food supply chain, and safeguards the health and safety of people working in food manufacturing and distribution. CFIA has proposed a net increase of $52.1 million in its 2022-23 main estimates. This includes funding for 1. Maintaining a daily inspection presence in federally registered meat processing establishment. 2. Maintaining and further strengthening food safety measures. And 3. Addressing antimicrobial resistance.
Alors que nous
As we learn to live with COVID-19, the importance of investing in health and medical research becomes more important than ever. The Canadian Institutes of Health Research proposed spending on health research for 2022-23 is $1,242,500. These investments will help provide the evidence needed to make better healthcare decisions during the pandemic and beyond.
Mr. Chair, the investments I have outlined today will help the health portfolio deliver on its mandate of maintaining and improving the health of people in our country. Our commitments are set out in our estimates, and departmental plans are a reflection of our most pressing health priorities. They demonstrate how we are taking action and are an assurance to Canadians that we will continue to protect and improve the health system. Thank you for the opportunity to provide my comments. I will be pleased to take questions from the committee after my colleague Dr. Bennett presents her remarks.
Thank you, Minister Duclos. And next, Minister Bennett for 5 minutes. You have the floor.
Je vous remercie.
Thank you for this opportunity to appear before the committee today for the first time as Minister of Mental Health and Addictions and Associate Minister of Health, here with my colleague Jean-Yves Duclos. I'd like to begin by acknowledging this meeting is taking place on the traditional territory of the Algonquin people.
Pleased to share with you our resourcing plans for 2022-2023. I think we all know that COVID-19 and the protective public health measures associated with it continue to adversely affect the mental health of individuals and families across the country. It's no surprise that many people are reporting an increase in stress, anxiety, depression, and loneliness. The pandemic has also led to an even more uncertain and dangerous illegal drug supply, resulting in significant increases in overdose-related deaths. Our government is committed to being there for Canadians, particularly in these exceptionally difficult times. As the Government of Canada's first Minister of Mental Health and Addictions, I've been mandated with ensuring that mental health is treated as a full and equal part of our universal healthcare system. I'm working collaboratively with the provinces and territories, experts, community leaders, and those with lived and living experience to develop and implement a comprehensive evidence-based plan to support the mental health of Canadians. Early in the pandemic, we launched the Wellness Together Canada online portal to provide free 24/7 mental health and substance use services and resources to people in need across Canada, including one-on-one counseling. In January, the digital access to this platform was enhanced with the companion app called PocketWell to ensure that Canadians have access to the mental health and substance use services they need, no matter where they live. Last week, I announced that we will also be moving forward in partnership with the Standards Council of Canada, as well as other stakeholders and partners, to develop national standards to address the needs of Canadians related to mental health and substance use. And this work on national standards is supported by $45 million from Budget 2021. We are committed to ensuring that all Canadians have access to high-quality, safe, and equitable mental health and substance use services. And, Mr. Chair, our hearts go out to all of the loved ones in communities of those we have lost to the worsening toxic drug supply and opioid overdose crisis. We are working closely with our provincial, territorial, and municipal partners, along with other key stakeholders like the impressive Moms Stop the Harm, with over $700 million to reduce harms, save lives, and get people the evidence-based supports they need. We know that the provision of a safer supply of drugs is essential to help prevent overdoses, and safer supply is a vital part of our comprehensive approach to combat this crisis. We've invested over $60 million to expand access to a regulated supply of prescription opioids and are committed to doing more. We firmly believe this is a health issue, and we're working to divert people who use drugs away from the criminal justice system and towards supportive and trusted relationships in health and social services. Our government will use every tool at our disposal to end this national public health crisis. Our commitment to these and other key priorities are reflected in Health Portfolio's main and supplementary C estimates, which we are here to discuss with you today. These include $82.4 million requested by the Public Health Agency of Canada to support the mental health of those most affected by COVID-19 and $14.3 million requested by Health Canada for the Mental Health Commission of Canada. Health Canada is also seeking an additional $65.1 million for its work to address the opioid overdose crisis, and the Canadian Institutes of Health Research is requesting $2.25 million for 2 Catalyst grant funding opportunities to support the development of national mental health and substance use standards. Thank you for this opportunity to discuss my new mandate and the Health Portfolio's estimates, and I look forward to expanding on my remarks through your thoughtful questions.
Thank you very much, Minister Bennett. We're going to begin with those thoughtful questions now, starting with the very thoughtful Vice Chair of the committee, Mr. Barrett, for 6 minutes.
Okay, thanks very much, Chair, and through you to the ministers and to all of the witnesses appearing. I thank them for their time today. Again, through you, Mr. Chair, my question for the Minister of Health. With 10 provinces having established plans that include benchmarks and dates by which all of their COVID restrictions will be lifted, based on advice from their top doctors, from the Chief Medical Officer of Health in each of the 10 provinces, what different information does the federal government have that is causing it to not provide dates or a plan that will see federal COVID mandates lifted?
Thank you, Mr. Chair. And obviously, we would all like to know by what time COVID-19 will end. And in fact, we would all like COVID-19 to have disappeared a long time ago. The truth is that COVID-19 is still here in Canada and certainly outside of Canada. And that's what I think we should be mindful of as in the way forward. We will want to apply the least disruptive measures in order to protect the health and safety of Canadians, and the conversation will evolve as the situation evolves.
Thank you, and through you, Mr. Chair, again to the Minister of Health. It would be important for Canadians to know what benchmarks the government has set that will see those restrictions lifted. So while I can appreciate that in the absence of those benchmarks, it's difficult to set a date. So is there a hospital capacity target that has been established by the federal government that once reached will trigger the lifting of federal mandates?
As you know, and as we know, most of the measures in place when we speak about restrictions and public health measures are in the domain of provinces and territories. The measures that belong to the federal government relate to borders, transportation, and the public service. These measures are focused on vaccination, and because vaccination is the key to the least disruptive possible measures to protect the health and safety of Canadians and their loved ones.
Again, through you, Mr. Chair, to the Minister of Health. So the number of fully vaccinated Canadians is over 85%. We've heard the Prime Minister say the number is in excess of 90%. What is the vaccination target that has been established that once reached would see the lifting of federal mandates?
Those are excellent questions. Let me first speak to the fact that vaccination still works. We do sometimes hear from all sorts of views, and some of them are perhaps not as well informed as they should be, that vaccination doesn't work anymore. Vaccination still works, and it works particularly well if you have a booster dose, which I think we all collectively want to encourage everyone to do. We currently have less than 60% of adult Canadians having received a booster dose. That's not enough. We need more than that to protect against Omicron and future variants.
Okay, through you, Chair, to the Minister of Health, is there a target number, a benchmark that has been established that once that number of eligible Canadians have received their booster dose, if it's at 60% now, is it 70, 80, 90% that once achieved, then that will trigger the end of federal mandates?
That's an excellent question. The answer is complicated and depends on both the prudential precautionary attitudes, the epidemiological situation in Canada and outside of Canada. It also depends on waning immunity, including waning post-infection immunity. If you're interested, and I think we might turn to Dr. Tam, who happens to be with us also today.
So, Mr. Chair, the same question to Dr. Tam, please.
Yes, so I think right now the epidemiologic situation is improving, but it is a little bit unstable. We have seen in European countries, for example, where a resurgence is being undertaken at this point in time. So I think, as the Minister of Health has indicated, the federal responsibility, for example, for the borders, and we do have to look at the international as well as the domestic situation and not just the domestic thresholds. At the same time, I think there is a phased approach being undertaken to begin to lift some of these measures, as you have seen being announced. But I think right now, the potential for the Omicron resurgence, particularly the subtype BA2, can still occur. So I think this is just waiting to see what happens with that situation, ensuring the provinces are still able to cope as they release their measures. They're just doing that at the moment. And having that observation as the federal government makes a decision.
Okay, thank you for that reply, Dr. Tam. I just have very limited time left, and so so the theme that I'm looking to establish through the chair to Dr. Tam, to the Minister of Health, is that we appreciate that the situation is evolving, but we have the situation where we have 10 provinces whose top doctors have all agreed that the epidemiological situation in Canada, based on hospital occupancy, based on wastewater surveillance reports, based on test positivity, reported cases every day, has created a situation where their requirement for vaccine mandates and for mask mandates have been lifted almost entirely, with all of them being lifted basically in the next 40 days. But we know what that target is. So, Mr. Chair, to the Minister of Health, if he could, what is that target that we're going to see that if it's hospital occupancy and the situation evolves, if once it drops back to 95% to pre-COVID levels, the restrictions are lifted, and then if it exceeds 105%, the restrictions are re-engaged? Is that what we're talking about? We're just looking for what that benchmark is, Mr. Chair.
Okay, Minister, we're well past time. If you could answer briefly, that would be appreciated.
So should I answer, Mr. Chair? Okay, good.
Please do.
Now, the question
as
is
succinctly
excellent.
as possible.
And you pointed out the fact that these decisions are made locally by provinces and territories based on their epidemiological situation, their ability to manage the burden on their healthcare system, including hospitalizations. We still have 5,000 people hospitalized in Canada now because of COVID-19. These are 5,000 beds that cannot be used for other people. So these decisions are based locally on the level of ability, their circumstances, and their ability to sustain the pressure that COVID-19 brings on them.
Thank you, Minister. Thank you, Mr. Barrett. Next, Ms. Sidhu, please, for 6 minutes.
Thank you, Chair. Thank you, all the ministers and all the officials appearing today. And Dr. Bennett, when you said that you're the first person to hold this portfolio, so congratulations on that. So my first question is to you. As much work has been done to reduce the stigma around the mental health and addiction issues, but it still exists, particularly among newcomers and racialized Canadians. Can you tell us how you will ensure that any care and outreach funded by the federal government will be culturally sensitive and intersectional?
Thank you so much for the question. And I think even as we released the Wellness Together platform in all of the languages, that we know that we've got more to do to make people feel more comfortable accessing support. We were pleased to see that men came, that the 2S LGBT community young people were using the site, but I think we know we've got to do better promoting the site in the more marginalized or ethnic communities, and we know that the South Asian community, a number of members of Parliament have come to me saying that we need a specialized approach for the South Asian community where the stigma is still very high. I think that overall, though, COVID has helped people admit they're struggling. That it seems to be more out there, that people admit that they're having trouble. And so I hope as that overall stigma comes down, that we can focus on the populations where it's still too high, and we want to make sure that people are able to access the care that they need. It means having trusted people in those various communities leading this work, and that's why we will need your help and the help of all members of Parliament.
Thank you, Minister. Next question to Minister Duclos. Minister Duclos, there's 11 million Canadians living with diabetes or pre-diabetes. I have met with many experts and Canadians living with this disease who may be at greater risk of severe COVID-19 outcomes. Minister, can you tell us what action our government has taken on this matter?
Thank you, MPs Sidhu, and thank you, Sonia. Thank you in part to your leadership. You have been a leader, and because of that, you have been able to make things happen certainly quickly. And one thing that your work brought to Canadians is the National Framework on Diabetes Act, which is extremely important because it's driven, as you said, towards caring for those that may be at risk or may be living with diabetes, as well as their families and their communities. It is also associated to that a $35 million investment over 5 years to do the research that is needed to care for those affected by diabetes. So it's a teamwork, it's team success, and part of it is not only due to you, obviously, as a person, Sonia, but all those that you have been able to work with over the last few months and years.
And follow-up question, Mr. Duclos, through you, Chair. COVID-19 has had a significant impact on senior populations, particularly elderly individuals. Minister, can you tell, please, what investment has been made to seniors in long-term care homes, and what actions we are taken to improve palliative care?
Thank you. We've done two things regarding safe long-term care, and we'll do more, as I'll mention in a moment. The two things we've done is first, when we first invested in the Safe Restart Agreement, there was a significant amount of resources which was intended and was used to help workers, personal service workers in particular, take care of our seniors. We then added last year in budget 2021 another $3 billion for exactly that same purpose, support healthcare workers in order for them to help care for our seniors. What we also said we would do is to put into place standards, which we are currently developing with external stakeholders and internal capacity, so that as we work with provinces and territories respectfully, we also treat our seniors in a respectful manner.
Thank you, Minister. Minister Bennett, last week announced the government was working with partners like the Standard Council of Canada to create national standard for mental health services. When they're going to be completed, how do you envision these standards being applied?
Thanks for the question, and it is that is $45 million working with that came out of last year's budget. The Standards Council does not set the standards. The Standards Council works with the people who know the most, the researchers, but also those with lived and living experience, community workers, to find out where there is a consensus evolve that should and could be a national standard coast to coast to coast. The most appropriate care in the most appropriate place by the most appropriate provider in the most appropriate time. What's exciting at the moment is that integrated youth services seems to be a place where 9 out of 10 provinces have begun that work of individualized wraparound services for that young person up to 26. So that's the example of a national standard, is that a integrated youth service would go to 26 wherever you live, and that people wouldn't be young people wouldn't be left out. So I think there's some really good examples of national standards, but it's a common statement that the provinces and territories came together with in 2017, and I'm very excited about the opportunities to do that. Perhaps perinatal mental health, but one of the things that we're worrying about are wellness checks, also the appropriate medically supervised withdrawal. So there are things that I've been hearing that then I get to go to CIHR and to afterwards the Standards Council and say, do you think there's a possibility of developing a team that would work on those kinds of standards?
Thank you, Minister. Thank you, Ms. Sidhu. Suite, c'est le tour de Monsieur Thériault.
Mr. Thériault, you have 6 minutes. Thank you very much, Mr. Chairman. Ministers, thank you and welcome to the Standing Health Committee. I don't have much time, so I'll get started, Minister. Budget 2019 announced $1 billion over 2 years as of 2022-23 and $500 million thereafter for the implementation of a national strategy on rare illnesses. The main estimates for 22-23 mentions nothing about this, despite the fact that in the ministerial plan for Health Canada for the same year, the measure is mentioned, and it says that the government will launch a national strategy on drugs to deal with these rare illnesses, to help Canadians who have these illnesses access the drugs they need. 2 questions. Why is the money not there for 22-23, and where does the implementation of that strategy land today? And sir, thank you for the excellent question. I'd just like to specify a couple of things, and then I'll ask the Deputy Minister, or rather, I'd like to add a couple of points, and then the Deputy Minister may want to add. Yes, $1 billion was the commitment, and that will be delivered. I would say, actually, that it was very well received well received by healthcare ministers throughout the country. And the third point that I would add is it has to do with this $1 billion and the way that it is provided for in the expenditures or the estimates. I will turn for that question. I will turn to Deputy Minister Lucas. Thank you, Minister.
I would just indicate in response that Health Canada, as the Minister has indicated, continues to consult and engage with provinces and territories and stakeholders, and in that will be able to define the path forward on this work on drugs to support those Canadians with rare diseases, and that will allow for that funding to move forward and be considered in a subsequent estimate.
Mais je comprends que pour
I understand that for 22-23, however, at this point, there's nothing there, is there?
Mr. Chair, I would just say in the context of the main estimates at this point, before the start of the fiscal year, those funds have not been moved forward for appropriations. It will be considered further to consultations in the coming weeks and months.
Parce que comme on le sait,
As you know, there's the main estimates today, but there are 3 other estimates that we call supplementary A's, B's, and C's. So there could be further announcements in 22-23. And with respect to the implementation of the strategy, what can you tell us about that? How are things happening on that front? It has a lot to do, as I was saying earlier, with my territorial and provincial counterparts. Of course, we will be turning to experts outside of the government. Of course, Health Canada has a number of experts, but we will work with the medical experts, researchers, and all providers, of course, specifically Canadian providers. How much time do I have left, Mr. Chairman? You have 2 minutes left? Great. A specific question now. You will agree, Mr. Minister, that having more than one antiviral available to counter COVID-19 is not really a luxury. When I look at the Health Canada website, I see that Paxlovid, which is an antiviral, a request for approval was tabled in December, approved in January. But what I also see that Molnupiravir, which has been tabled on August 13, has not yet been approved by Health Canada. We know that Paxlovid has some admin aspects in terms of administration of this medicine because it contains ritonavir, which might interact with other drugs. Molnupiravir seems less concerning with respect to any potential interaction with other drugs because it does not contain this ritonavir. A simple question: when will that be approved? Why is it taking so long? And is this a human resources problem to get things approved on this front? Thank you. It's not surprising that you would have heard this, and congratulations on your in-depth work on this. This is not only a serious issue, but it's really important. And I think you mentioned it. The Health Canada approval happened quickly. Why? Because they worked with international partners. I think we were one of the 4 top or first countries in the world to be able to approve Paxlovid and the second to administer it. Third point, provinces and territories already have a significant stock of this drug. It's being used clinically. It's effective. And we've seen details from Quebec recently as to encouraging results and its availability in pharmacies. For any other drugs, including any Merck, anything from Merck, there are tests that Health Canada has to do with respect to the effectiveness, etc., of that drug. Certainly, we could turn to the experts from public health on that if we want more details. Thank you, Mr. Thériault.
Welcome to the committee. You have the floor for 6 minutes.
Thank you very much, Mr. Chair, and thank you to the committee for allowing me to ask some questions on behalf of my colleague, Mr. Davies. Good to see you, ministers. My first questions pertain to the toxic drug crisis that is being experienced across the country, particularly in my home province of British Columbia, and is leading, as everyone here knows, to a devastating number of deaths in communities of all sizes. Minister Bennett, my questions are for you as the minister responsible for mental health and addictions. Do you believe that criminalization contributes to the stigmatization and marginalization of people who use drugs?
Yes.
And do you believe that the criminalization of substance use causes disproportionate harm to racialized and Indigenous communities?
I think that we know that we have to move from a criminal justice system to a system that sees substance use as a health issue, and that we will do everything we can to support them there. But I think, as you have said, the toxic drug supply means the most immediate remedy is going to be a regulated supply of drugs for people using drugs. And that's what we've been announcing, and being able to invest over $60 million over this last to be able to do that pharmaceutical grade drugs, so that people don't have to go to the streets and use the toxic, poisoned, deadly drug supply.
And I agree, Minister, that is certainly an important component of the solution. But the reality is that the criminalization of drug users keeps some people away from early treatment, from prevention services, due to a fear of being arrested, being labeled, being outed. Do you recognize the role that criminalization is playing in this toxic drug crisis?
Well, I think, as you know, the Office of the Public Prosecutor has issued a guidance document that is asking police forces across the country to not charge people, and that has been a practice now across the country. So people aren't as worried about being charged because it isn't happening. But it is. But at the moment, I think that certainly in speaking with Mayor Kennedy Stewart, that they're worried about the confiscation of the drugs, even if people aren't being charged. And I think that we are looking at all the international models to be able to figure out what is the best way forward as we want to end this national public health crisis.
I accept that, Minister, but the reality is that despite the practices of some police forces, there are still drug users out there who have criminal records, who experience stigmatization and marginalization as a result of those records. And there's still the fear that because drug use is still criminalized in Canada, that users of people who use drugs could suffer legal consequences, and that criminalization prevents them from accessing the health services that they need. Do you recognize the role that criminalization plays in the current toxic drug crisis?
At the moment, to me, the toxic drug crisis is about getting safer supply, a regulated drug supply to these people. I think that there's no question that the pilot projects that will come forward, hopefully with British Columbia, Toronto, Vancouver, we'll be able to put a evidence-based framework around what you're describing. But at the moment, for us to have moved from 1 to 38 safe consumption sites, and for us to be able to invest in all of these programs across the country, 4 of them last week, on safer supply. I think, though, the other piece that we're hearing a lot about is that at the moment our safer supply programs are prescribed by physicians, and there is a real movement to be able to look at other ways of getting safer supply, maybe using compassion clubs, pharmacists, and other ways of doing this. So that's what we're hearing as the priority of people using drugs.
Minister, I hear the focus on safe supply, and that's something I believe that's welcomed from a health perspective, but it's not the only component of the solution. And Health Canada's own expert task force reported last July that, yes, safer supply is an important component, but they also emphasized decriminalization and record expungement. Do you accept their recommendations, and will you implement them?
I think, as you know, with as in the journey with cannabis, decriminalization still means people go to the street to get their drugs, and they are still dying. And so I am focused on getting safer supply to the people using drugs. You need to know, my father was a police officer before the Second World War, and when till the day he died at 93, he thought that prohibition didn't work. So I mean, I come from a certain point of view on this, but this is a journey, and that we're going to have evidence-based approaches to keeping people safe, and with the proper process and the proper evidence.
Do you disagree that there's evidence suggesting decriminalization works?
That's your time, Mr. Bachrach, but you're going to get another chance.
Thank you, Mr.
Okay, thank you. Next, Dr. Ellis, please, for 5 minutes.
Thank you very much, Mr. Chair. Thank you, Mr. Chair, and thank you to the ministers for attending today to the Standing Committee on Health. I'd like to start with the Minister for Mental Health and Addiction Services. In numbers, Minister, could you tell us the Wellness Together portal, the costs on a per-patient basis?
No, maybe I can go to the official. I don't have it broken down per patient, but I do know that we are well over 2.3 million people that have used that portal over the last while, and that the evaluations have been extremely positive, and the provinces and territories are very helpful that it has taken the pressure off their system.
Minister, yeah. I am asking very pointed questions. I appreciate that you would just answer them as such. And ma'am, if you could,
it depends how many people use it, what the cost per patient is. The more people who use it, the less the cost is, right?
Mr. Chair.
Okay. Minister, we're going to endeavor to have the questions and the answers at roughly the same. So I think Mr. Ellis has moved on. I'm sure you'll get a chance to elaborate. Go ahead, Dr. Ellis.
Thank you, Mr. Chair. And I'm wondering if the minister could table those answers, please, this committee. Very important. Appreciate that. Minister of Health, difficulty here, sir, understanding in my own mind, you suggested that Canadians know what to do with respect to mandates, and I think that Canadians know what to do. However, we've heard both, sir, from you and Dr. Tam, that the answer to why federal mandates continue is complicated. And I guess I find that quite shocking, that there's not an answer to be given, that it's much too complex for the Health Committee and for Canadians to understand. I guess what I have heard from Dr. Tam is that there are perhaps worldwide issues that play into that. Could you please, sir, give us the plan for the Canadian part of that? What are the metrics? What are the benchmarks for Canadians? Canadians want an answer, and I guess that's why we continue to ask this question, sir.
Well, I'll give you a couple of numbers which will broaden the discussion, perhaps. There were yesterday probably around 20,000 new cases of COVID-19. Past estimates of the rates of long COVID among infected Canadians are about between 10 and 30%. So we don't know if Omicron exactly, but 10 to 30% of people having having been infected by COVID, ending up with long COVID, that's a very significant economic and social cost, for which there is little, obviously, precise value when it comes to dollars, but it's a big thing. And just another number is $23,000. That's the average cost per hospitalization due to COVID-19. Again, costs are something, it's not enough, but it gives you an example of the type of numbers and people impacts that we need to consider.
Thank you, Mr. Chair. And to the Minister of Health again, sir. So are you suggesting that that post-acute COVID syndrome is the reason why we will continue federal mandates and keep federal employees off work? Another number is 59. Yesterday we had 59 people dying of COVID-19. What's the value? What's the value of that? Of those numbers of lives being lost to COVID-19? Yeah. Mr. Chair, thank you, Minister. I understand that there appears not to be an answer. Can you tell me, sir, perhaps in numbers, the number of federal employees currently off work because of federal mandates? Well, the Treasury Board Secretary would know precisely
the number, but it's about 99% of public servants who have been vaccinated. So 99% is, I think, a signal that public servants care about their health and the health of their colleagues.
Mr. Chair, thank you. And maybe I didn't ask how many people were vaccinated. I asked how many federal government employees are off work due to federal mandates. The number of people off work, not how many people are immunized. I get that part. How many are off work? Number.
So you'll need to ask for a good answer, which I think you deserve. You'll need to ask the Treasury Board officials to know exactly how many of the 1% remaining or remaining because of all sorts of reasons, perhaps because they have been partially vaccinated and are looking forward to a second dose.
Thank you, Mr. Chair. One final question to the Minister of Health, please. Is it true, sir, that Medicago, which was invested by the federal government of $173 million, is one-third owned by Philip Morris Incorporated? Yes or no?
I wouldn't know the precise percentage. What I know, however, is obviously the pride that we have of having the first Canadian company not only produce a vaccine, but a vaccine with a technology that is nowhere seen elsewhere in the world.
Funded by a tobacco company. Thank you, sir.
Thank you, Dr. Ellis. Thank you, Minister Duclos. Next, Mr. Johari, please, for 5 minutes.
Thank you, Mr. Chair, and I'd like to welcome both ministers to our committee. I'm going to start with Minister Bennett. Minister Bennett, in your opening remarks, you talked about the $45 million investment for national standards, and as my colleague MP Sidhu was following up, you made an announcement on March 14th where you talked about the Standard Council of Canada. And the fact that they will be working with various stakeholders. Now, can you explain to me how these standards are going to help the following? So we know the investment on mental health as part of a total health transfer is an area of interest for a lot of us. We know there are a lot of gaps as far as the timelines and as far as the delivery of the services. We know a lot of my constituents in my health community council are talking about transparency, about accountability, about reporting, regular reporting, as well as benchmark that right now we don't have, whether it's against some of the leading countries or whether it's even nationally here. Can you explain to us how these standards are going to help us? Thank you.
Thank you for the question, and I very much enjoyed meeting with your council as well. That's a pretty knowledgeable group there. It is a process that is, and I think that people know what the standards are on blood pressure, what it should be, what's appropriate for cancer. I think that what people haven't felt is do we actually know what is the appropriate treatment? And one of the things that's the most exciting for me as I continue to say the most appropriate care in the most appropriate place by the most appropriate provider at the most appropriate time is that throughout COVID, we also are seeing that the most appropriate place may be virtual. And up until now, the medical community and the mental health community hasn't had as much experience or even a way of paying for virtual care until COVID. And so what we're saying is that the developing the standards mean that Canadians will know what is the appropriate care and they can ask for it, ask their family doctor, their nurse practitioner to get it. And the exciting other part is that we are seeing a stepped care model where it may be the strongest families, where the families are just being coached, or it may be that it is a peer support, or it can be co-treatment with a family doctor and a mental health provider, a social worker, a psychologist, a psychiatrist. And what was really interesting last week when we did the roundtable on perinatal care, perinatal mental health, is of the study of Dr. Vigod, of the 40 people needing mental health, perinatal mental health, only 2 ended up needing to see the specialized psychiatrist. The rest were helped with other levels of care. And so that's the kind of thing, because I think that some people think it's not appropriate care unless they got to see a psychiatrist. We know that there are many other mental health providers who are skilled at various other aspects of mental health and substance use. So I think it's about, the standards won't mean anything on their own unless Canadians know what they are. And that's, I think, that mental health literacy, all of those things that we're working on
thank you,
as
Minister.
parliamentarians.
Also in your mandate letter is you're mandated to establish a permanent ongoing Canada mental health transfer to help expand delivery of high quality, accessible and free mental health services, including prevention and treatment. How does these standards are going to help you with delivery of this mandate item?
Thank you. And so the standards are almost like the pillars on which you build a mental health and substance use strategy for the country. That this is a what, by, when, and how in terms of a strategy, and then the transfers will be based on that. I think the words that I've heard the most going across the country on the transfer is, think childcare. People want it to be that there would be expectations around data collection, on evidence, and on outcomes. And so that is, again, something that we will negotiate with provinces and territories as we are working with them now on a mental health strategy.
Thank you, Minister. Thank you, Mr. Johari. Suite Monsieur Thériault pour 2 minutes et demie.
Mr. Thériault, you have 2.5 minutes. Thank you, Mr. Chairman. Just for the record, with respect to Molnupiravir, 22 countries have approved it. The U.S., Mexico, Morocco, the UK, Indonesia, Serbia, Slovenia, Japan, and other countries as well. So it seems to me that we should speed things up on this front so that we can ensure some diversity in therapeutics, specifically for our frontline workers, our doctors who are dealing with these issues. That being said, Health Canada consulted the public in March 2021 to address issues relating to personal use of cannabis. All levels of governance complain about regulations because it leads to problems, overproduction, overuse of the program, overprescription by doctors, lack of inspectors at Health Canada, and therefore not enough inspections. All stakeholders agree that the government has to deal with these medical cannabis use measures and increase inspection measures. This has been since 2018, and now here we are. What actions have been taken, and what will you do in the coming months to remedy this problem? Thank you, Mr. Thériault. Thank you, Mr. Chairman. The good news is that, as we know, we probably already know, legislation requires that the Canadian government review this act, and that's something that will be done by March 2023. The process is already underway. There will be announcements shortly to strengthen this consultation process so that we can, as you mentioned, take advantage of the fact that we have a legal framework, a regulatory framework that is much more solid than what we used to have. A framework that ensures that the consumption of cannabis happens in a way that is safe, avoiding all the pitfalls and all the damage that might be caused by the existence and proliferation of illegal cannabis use relating to organized crime, for one. There will be activities, additional investments along with the ones we've already made to address the point that you've raised, so that the legislation and procedures associated with it are improved over time. Thank you, Minister. Thank you, Mr. Thériault.
Thank you, Mr. Chair. I'd like to pick up where I left off with Minister Bennett, talking about the toxic drug crisis. And in May 2021, as you know very well, the City of Vancouver finalized its application and its final proposal to Health Canada for a Section 56 exemption under the Controlled Drugs and Substances Act to decriminalize simple possession of illicit substances. We're approaching a year since they submitted that proposal, and yet there still hasn't been a decision. And at the same time, we see deaths from this crisis rising every single month. Do you feel that that delay in rendering a response is acceptable? And can you confirm by what date Health Canada will have a response to the City of Vancouver?
Thank you very much for that. And of course, there is also the proposal from the fall from the province of British Columbia. And so that there is a view, I think, from the province that if there could be one for the whole province, that would be in the interests of the province, the simplest thing to do rather than have it separate plans for different municipalities. But we hope that they can work together to resolve this, but we want this to make sure that it can be successful implementation, and the kind of training that I think Vancouver's done with the police force, and I think that we're getting there. I think we're almost there, and
Minister, if I may, it sounds like you're saying that the ball is in their court, and that the province and the City of Vancouver need to resolve some difference before Health Canada is willing to make a decision. Is the City of Vancouver's proposal being actively considered, and will there be a decision, and when will that decision take place?
We do, you're quite right, have to render a decision on each of them separately, which we will do. And we are moving, I think, very close to that point.
Is there a timeline for a final decision?
The timeline is when we're satisfied that this is going to be successful and implementable.
Thank you, Minister. Thank you, Mr. Bachrach. Next, Mr. Lake, please, for 5 minutes.
Well, thank you. Mr. Bennett, does Canada currently have a 24/7 suicide prevention hotline?
As you know, there is a line that people can call, the national hotline, and there's a separate one for First Nations, Inuit, Métis. As you know, at CAMH, they are working on that kind of support across the country.
So yes, there is a line. I'm just curious. Do you, off the top of your head, know what that phone number is?
I do not.
Okay, it's 1-833-456-4566 for anyone that might be watching and want to know what that is. Do you know what the proposed 3-digit number is off the top of your head?
988.
Right, so you know that one off the top of your head, but clearly don't know the other one. Does that tell you something about the importance of a national 3-digit suicide prevention hotline?
I think that we are working very hard. It was a unanimous vote in the House of Commons, Mike, as you know, and we're working very hard. CRTC asked to have a little bit more time on the consultation because of persons with disabilities, and we hope that we will get that consultation finishes this month.
So we passed that motion back on December 11th, 2020. That given the alarming rate, this is a quote, given the alarming rate of suicide in Canada constitutes a national health crisis, the House called on the government to take immediate action in collaboration with the provinces to establish a national suicide prevention hotline. Immediate action, now it's 465 days since that point of time, and if we extrapolate from the numbers, that would be over 5,000 Canadian deaths by suicide since that time. Why is it taking so long?
Well, as you know, that the concern has been that it must be hooked up to the most appropriate care. And so that is the work that CAMH is doing. And it's what we're hearing from the provinces and territories, that when someone calls that, what support do they get? And is it possible? As you know, Mike,
we already have a 24/7 line that the Government of Canada promotes on their website. And we have a 988 line that's not in use currently right now that could be used so that the 24/7 line is just readily available in people's minds, and certainly there's work that needs to be done on the part of the stakeholders to make sure the capacity is there. But of course, we have that line that exists already. It's 465 days. It's 5,115 deaths at this point in time since we passed the unanimous consent motion. I'll note that in answers to questions, the first time I asked the question on December 7th, you said that the CRTC was currently considering public input from consultations that concluded on September 1st. That wasn't actually the case because at that point the time frame had been extended. Your parliamentary secretary, who happens to be with us today, later pointed out that, as you just mentioned, that the time frame was extended. Reopened the consultations, quote, the CRTC reopened the consultations to allow for new interventions in accessible formats such as video, so to accommodate people with disabilities. Now, in the last 4 or 5 years, on a repeated basis, including in 2 election campaigns, your party has declared that everything the government does will be undertaken through a disability lens. In fact, there was a big debate in the House of Commons prior to the 2019 election on accessibility. I took part in that, as many of your colleagues did, and that was a declaration made by your party. We are now 6 months past the original September 1st deadline and still consulting. It seems because the government didn't apply a disability lens to the suicide prevention hotline. Was that an oversight on the part of the government?
As you know, the CRTC is an arm's length organization, and we don't interfere with. But it seems that they have decided to reopen the consultation in order to put on that disability lens that is so important. The other thing, Mike, is that some jurisdictions have their own number, and so this is about making sure that this is all coordinated.
Clear, the Government of Canada on their website points to one 24/7 number that already exists that you couldn't remember off the top of your head. This is simply a proposal to direct Canadians who are in their darkest moment to an easy-to-remember 988 number that they can call to presumably get the same services that they would already get if they could remember the number that already exists.
I think you and I know that suicide prevention is a life cycle approach, that we actually need to do everything we can in terms of supporting people in mental health concerns throughout. And whether it's wellness checks or whether it's all of the things that have had disastrous outcomes, we need to make sure we've got a system that will work for Canadians and work in every part of the country. When 911, Mike, when 911 came in, rural Canada was way, way behind because they didn't have the capacity to be able to implement 911 at that time. We can't launch something if it won't be universal. And that's, I think, the work that CRTC is trying to do.
Thank you, Mr. Lake, and thank you, Minister. That's a fascinating discussion, but we have to give some other people a chance. Dr. Hanley, please, for 5 minutes.
Thank you, Mr. Chair, and thank you to both ministers for appearing and to the officials. Minister Duclos, I'm really pleased that you could spend the time with us. And the last time that you were here, I asked about long-haul COVID or post-acute COVID, and I'm glad to see that you already spoke to the importance of long COVID in the burden that is presenting to Canadians. And I've certainly heard from constituents in Yukon with long COVID having some difficulty accessing care or receiving a diagnosis. Healthcare provider knowledge in this area still appears to be quite limited and inconsistent. So I was wondering if you could describe what role you think the federal government should play in advancing progress in addressing the medical needs and the support for patients and their families with long-haul COVID.
Thank you very much, Brendan, and I'm pleased to be able to have this discussion with you. You know, being a medical doctor, and a public health specialist, you know that now in the pandemic there are there are eventually a lot more impacts than we would have thought earlier. And one of these impacts is the long-haul COVID, also the long COVID. I mentioned earlier that the best estimates we have until now is that between 10 and 30% of those infected with COVID would end up with long COVID. That means having a variety of up to 100 different symptoms affecting 10 different organs, vital organs. A large number of these people have to either stop working or reduce significantly their hours of work. The estimate is about 30% of those people affected need to stop working or to stop studying. 70% of them reduce their hours of work or absent. A large number, I think it's about 30%, will consult more than 10 times a healthcare worker. So you see the impact on the healthcare system as well. All the human costs, the lives costs, all the tremendous economic costs, obviously, that's all adds up. So researchers, and I would be glad to turn, if you wanted, to Dr. Strong, Michael Strong from the IRSC is on the line, would be very pleased, very useful in detailing the type of research that the IRSC are conducting to understand the nature and the impact of that other pandemic, in fact. Dr. Strong, would you be able to do that?
Yes, thank you very much, Minister, and thank you very much for the question. The consequences of COVID-19, as the Minister has indicated, upwards of 30% and higher in some populations, will be long-term, measured greater than 6 months. No organ system is spared. So the research that is going to be conducted going forward will be to develop not only the diagnostic criteria for some of these syndromes, as you've alluded to, so that there can be clarity for the patient populations as to what need to be treated, but as well to clearly understand what the underlying basis of the disorders are. It is not going to be the same for each target organ as we look forward to this. So it's going to be complicated and will be long-term studies that are internationally driven, and CIHR, through the commitments of the government for the $100 million for the long COVID research, will begin that process soon.
Thank you. Mr. Chair, if I may pass to Dr. Tam. And Dr. Tam, hello again, and thank you again for being with us today. I certainly, there has been a lot of talk, including in this meeting, from our colleagues on mandates and various public health measures and the lifting thereof. And I would like to give you an opportunity to explain what we have learned and what we hope to learn from Canada's experience with vaccine mandates and passports, and how would we apply these learnings to either future waves or future viral threats?
Thank you very much for that question. And Mr. Chair, I think there is no denying that vaccines are extremely foundational to our response to COVID-19. And right now, the National Advisory Committee on Immunization has provided recommendations, including up-to-date vaccination with booster doses, particularly for the high-risk populations. So I think it's really important that anyone for whom the booster is recommended and eligible get that at this point. So as to how do you increase vaccination in the general population and in targeted ways is a multi-pronged approach. I do think that vaccine mandates, when they were introduced by provincial territorial governments and also the federal government for its own area of roles and responsibility, occurred at a time where, before Omicron, where we saw, extremely high vaccine effectiveness, both against infection and against severe outcomes. And Omicron kind of changed that picture. But we know that there's certainly studies, including from Simon Fraser University, that show the initial impact of collectively, I think, on the vaccine mandates that were implemented around mid-August that saw an increase in coverage. But that's different in each jurisdiction. And I think that needs to be studied at that kind of more granular level in terms of the impact of vaccine mandates. Going forwards, I think there is a movement, certainly in the provincial territorial setting, to move from requirements to recommendations. That's going to be, really all hands on deck yet again, using all kinds of techniques to improve vaccine confidence, providing the information that patients and individuals need. And that information has been provided by credible sources that are trusted by the community, including Indigenous leaders, including racialized communities and their leaderships. So I think there's multi-pronged ways in which we encourage, recommend, and get people to get that additional dose, which, as the Minister of Health said, is not really very high. I am, though, encouraged that booster doses are quite high in the higher risk populations, but I think the 50 plus, we need to up our game, I think, on that coverage. I think all of this
can you wrap it up, Dr. Tam? We're well past time.
Okay, all of this experience can be used to increase, because vaccines are going to be useful in future pandemics. And so we can use all of the experience in the last couple of years to future applications as well.
Thank you, Dr. Tam. Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair. Through you to the Minister of Mental Health and Addictions, you repeated multiple times in your opening remarks that you're working to implement a safe supply of opioids. Can you provide any medical evidence that has been used to support these decisions?
Absolutely, and we can show really the lives that have been saved, in particular now in the process of the that we will be able this week to release what would have happened without safe supply or without safe consumption sites, and so we are approving the and also Health Canada has approved the diacetylmorphine as well. Fentanyl patches are being used at St. Paul's Hospital in terms of overdose prevention sites. This is working.
So could you then perhaps table any medical evidence that supports the use of safe supply?
Absolutely, and I'm sure that that CIHR and all of that this is saving lives. That when you see what's happening, that even naloxone is not working for what is on the street. People are, because it's mixed with benzodiazepam. It's a deadly cocktail that people are getting on the street, and for people using drugs, there is no question the safe supply is saving lives.
In my home province of Alberta, they're actually doing a study right now on this very topic, and Dr. Keith Humphreys, who is the chair of the Stanford Lancet Commission to examine the North American opioid crisis, stated, one, and I quote, "There is no evidence that this approach will have positive outcomes, and that there is significant longstanding evidence that more opioids there are in the community, the more harm there is in the community." So I think that that's very concerning.
Lila, I think it'd be really good for you to talk to the people like Petra from Moms Stop the Harm in Edmonton. That organization of moms that have lost a loved one to toxic drug supply, they are some of the most effective advocates for this from all walks of life. This is and also I think to actually talk to some of the people using drugs and the people who are the 30,000 overdoses have been over.
I've been very succinct in my questions.
Yes, indeed you have, Minister.
Okay.
We'll try to allocate the time evenly between the two of you, and go ahead.
I've been exceptionally succinct in my questions. I would just ask that you try and be succinct in your answers. Because you've brought up Mom Stop the Harm, one mom in Lethbridge with Mom Stop the Harm last year stated that their organization was directed by the former health minister to circumvent the province by getting municipalities to pass motions on decriminalization and safe supply. have either of your offices directed this group in any way to push the government's agenda in public, and how much funding does this organization receive?
I've certainly, Mom Stop the Harm is upset with us at the moment that we didn't intervene in the Alberta case, which is where Premier Kenney is making identification mandatory for people using safe consumption sites, which we know is a deterrent to using the safe consumption sites. And obviously the Mom Stops the Harm is an advocacy organization that is, I think, motivated by the fact that they've lost a loved one.
Goodrich?
How much funding does this organization receive from your department?
I am not aware.
Would you please table that with the committee?
Absolutely. I don't know if the deputy, or is there any?
Mr. Chair, we can follow up as the minister indicated and table that information.
Fantastic. So the Minister of Mental Health and Addiction, you've repeatedly talked about how the addiction crisis is a toxic drug problem and that the solution is safe supply. The last drug that was marketed as safe supply was OxyContin, which is pretty much responsible for our current opioid crisis. It's effectively a marketing term rather than a medical terminology. I'm just wondering, what is your department and your budget doing to support recovery from addiction, not just safe supply?
Thanks for the question, and I think the Sacklers and the people that falsely claimed that OxyContin was not addictive or was less addictive are now paying serious consequences. That was a false claim by the pharmaceutical company. Our safe supply is addictive. Heroin is addictive. Diacetyl morphine is addictive. Dilaudid is addictive. But by replacing the toxic poison drug supply with a regulated pharmaceutical grade narcotic is saving lives.
That's better than treatment?
Thank you.
So that, and I will table, there's lots of money on treatment. Obviously, there's the emergency treatment fund, 150 million went to the provinces, up to 300 million. There's lots of money going to addiction, $5 billion on mental health to the provinces and territories. In the provinces and territories deliver treatment, and we give the money to the provinces and territories to do that.
You, Minister. Thank you, Ms. Goodrich.
Point of order, Mr. Chair.
Yes.
Just super quickly, my colleague asked for information from the department in terms of funding. I'd like to make sure that it's clear that we get information from the government as a whole. And secondly, the minister referenced the serious consequences the Sacklers and Purdue Pharma faced. I would like the minister, like it if the minister could table with the committee what serious consequences the government of Canada they faced from the government of Canada as well. Thank you.
Well, I think Ms. Goodrich's request of the minister was clear. I think that you may be adding another element to it, and I'd welcome you to do that when you have the floor and not on a point of order. Mr. Van Couverden, please.
Thank you, Mr. Chair. My first question will be on the subject of mental health. And earlier in this meeting, the PocketWell app was mentioned, and I downloaded it just before my 40th birthday a couple of months ago because I was having some ups and downs, as a lot of people do. And I've used it a couple of times, and it actually just gave me a notification that it's time to do another assessment. And I've got to say, anybody who has downloaded this as a result of me putting it on social media or just word of mouth has come back to me to say, you know what, that thing identified a couple of things that I can do, and it's making a difference. It's making a difference for me. So I wanted to say thanks. I wanted to ask about PocketWell a little bit and what else that we're doing, because I know there's lots of other concrete steps that our government's taking to address mental health, and there are a lot because it's a complex challenge, complex problem. But I also want to talk about kids. In the previous Parliament, I got to serve as parliamentary secretary for youth, and on that file, I got to work with a lot of kids and a lot of youth groups. And COVID-19 has affected all of us negatively, and we've all made lots of sacrifices. But what kids have lost, particularly when the pandemic accounts for a quarter of their lives, in the case of my goddaughter, it's been a really extraordinary upheaval of everything that they know. So through you, Mr. Chair, to the Minister of Mental Health and Addictions, if you could talk a little bit about what else we're doing with respect to mental health for people, but particularly for kids.
Thank you so much. And I think I did have my youth council have a look at both Wellness Together and Pocket Well, and they, they're hard markers, and they were very positive about it. I've signed up too, and I think that because it is people like the Kids Help Phone, it's Homewood, it's the Step Care, that consortium that Minister Haiju and the department put together at the very early part of COVID has really worked, and now 2.2 million Canadians have used it, not only to browse the kinds of resources that are out there, but also to get 724 care advice if they need it. And so it's, I think we will continue to evaluate it, but I think so far we think the 62 million's been well spent, and it is, but also for younger people using it. We're very happy that is a way of them accessing without stigma and coming forward. As I was saying to your colleague about the integrated youth services is, I think, one of the really exciting advantages now coming forward in terms of consensus, how you can get wraparound individual care for a young person is I think, now building into a real movement across the country because of places like the Foundry in British Columbia, that they actually now are training handbooks for peer support. They're just getting all of the resources such that this can take place coast to coast to coast. So I think, with great leadership like Kids Help Phone, I think we're going to get there.
Thank you, Minister. My next question is to the Minister of Health. On a similar subject, my Pocket Well app gives me advice. It sort of asked me to create a little bit of a strategy to deal with some of those ups and downs. And so I made a list of things that I should be doing better. And two of those things are getting enough physical activity, getting enough exercise. I certainly don't get as much as I used to, but it's still a really important component in ensuring that I'm good at my job and I'm as happy as I can be. But it also tells me to eat well and to remind myself this job can be time-consuming and challenging, but diet and exercise are part of my strategies. And I know they're also a big part of our strategy as a government to ensure that people have resources that they can access, so that people have access to physical activity programs and activities, as well as infrastructure to do that. But also, that we have information on how to eat well, how to access food, particularly in the era that we're in with the rising costs of food. Can you detail for the committee, through you, Mr. Chair, some of our strategies to help people eat well and exercise more?
Thank you, Adam. Thank you for referring to your former life. It would be hard for most of us to have the type of active living that you had when you were slightly younger. That would be a standard that I think would be of some concern to some of us. But you are correct. No, I have my five objectives, as you said: sleeping well, eating well, exercising, looking after my family, and spending some time with friends. So when I do these 5 things, I feel fine. Now, it's all about recognizing, as you said also, that COVID-19 has been hard on all of these 5 things. Sleeping well, eating well, in particular in your you're at home, you're not necessarily always happy to cook your own food, so you cheat and buy fast food more often. Exercising is not necessarily the best option when you have to stay home. So, and then looking after your, having time with your friends, that's obviously also complicated in COVID-19. And looking after your family when everyone feels a bit stressed is perhaps the right thing to do, but not always straightforward. So the healthy, I think you call it the healthy food guide, is something that I think we need to, and I think we will be doing to need to promote more often and better connected to healthy living. I think that is obviously going to increase mental health and physical health combined together. Without physical health or without mental health, there is no health, and I believe that us as leaders and user to me as a very global person can show the way forward.
Merci, le ministre. Mr. Thériault.
Thank you, Minister. Mr. Thériault, 2.5 minutes. Yes. Minister, let's now look at the CFIA, Canada Food Inspection Agency. We know that producers from Canada have to compete with products that come from abroad that might be less costly and also produced under different standards as in Canada. Our producers do not want standards that are inferior to ours. They want reciprocal standards. I've been here since 2015. There's been talk about reciprocity in standards for all this time, but it seems as though the agency is having a problem with this or having some challenges. And when I look at the budget item for the CFIA, does the CFIA have the means to ensure that these standards are reciprocal? And if not, what are we doing about that? Because we're really talking about people's health here. Answer, there are 3 aspects to your question. First, reciprocity. Second, the issue of the agency's capacity to do its work. And third, the budget the agency has. I'll turn to Madame Lapointe because we have the opportunity today to have the Vice President of the agency here to give us some quick answers to those questions. Thank you very much for the question, Mr. Chairman. Whether products are prepared here in Canada or imported, the same standards have to apply. We have increased our inspections, our lab testing, and our monitoring programs. And we are currently developing systems to really target products that may be higher risk. And we are strengthening a relationship with the Canada Border Services Agency as well. I hope that answers the question. Thank you. So what you're saying is that you don't need additional resources here to make sure that when there is some kind of, dumping of grapes from a given country full of pesticides, you are in a position to remove this from the market. You have all the inspections done and all the inspectors needed to do this. Is that what you're saying? So that it doesn't end up on store shelves. As briefly as you can, says the chair. Yes, we have a system that is based on identified risks, and we have the means, including given the budgetary increases we've received, we do have that. Thank you. Madame Lapointe, Mr. Thériault.
For 2.5 minutes.
Thank you, Mr. Chair. I'll direct my next questions to Dr. Tam. And Dr. Tam, since I haven't had an opportunity yet to thank you for your work, I'd like to do that and really express my appreciation for all of your efforts since the beginning of the pandemic. Now, at a news conference last Friday, you announced that the federal government is actively reviewing all vaccine mandates, and you noted that policies may soon shift from an emphasis on requirements to recommendations. Can you confirm when that review will be complete?
Well, the review of these policies are in the domains of other departments, including the Treasury Board. So I think some follow-up with that department and the employer essentially would be the most appropriate.
Okay, I suppose that I interpreted the remarks to include all vaccine mandates across departments, including the ones related to travel. So I'm wondering if the vaccination requirement for domestic air travel is included in the review that you referenced at the Friday news conference.
Yes, so there's different vaccine mandates, if you like, or other mandates in relation to the federal roles and responsibilities. So the federal workforce is one, which I just mentioned, Transport Canada and other departments, and working with the Public Health Agency and others will be reviewing and is in the process of reviewing the policies related to domestic travel.
And do you have a timeline, Dr. Tam, for when the results of that review might be released?
I don't personally, and again, that is led by another department, and perhaps the minister will have more information on that.
So, Dr. Tam, the review that you referenced at the Friday news conference, is that a review that each department is undertaking independently in relation to their purview?
Well, I think there's a broad interdepartmental approach to reviewing all of these different types of mandates. So it is a collective multi-departmental process. But there are lead departments depending on which policy you're talking about. And I don't have any specific response for you about their timelines, but I know that there's active reviews. For the federal workers or federal departments, I know that there was a built-in 6-month review process in any case for that policy.
Thank you, Dr. Tam and Mr. Bachrach. Next, Mr. Barrett, please, for 5 minutes.
Okay, thanks very much, Chair. And so I'm going to address my my next questions through the Chair to the Health Minister, and perhaps he can follow up on what Dr. Tam has just replied to Mr. Bachrach. There is a review that Dr. Tam has said is being undertaken with respect to federal mandates. Through the Chair to you, Minister, do you think that there should be a timeline by which that review should be completed? And if so, when do you think that review should be completed?
Well, let's be clear. These reviews happen every week. We have cabinet committee meetings every week, and sometimes more than a week, more than once in a week around these issues. So it's not as if suddenly we decide to review policies. These policies are reviewed continuously based on the things that we know matter, as we said earlier, which is the science, the precaution, and the situation, the epidemiological situation, both inside Canada and outside Canada.
Okay. So thank you for that answer. Again, to the Health Minister, and if you could reply in about the same amount of time as I asked the question, does the government have a plan that would see federal mandates end?
Well, we have a plan for every possible policy that we need to consider in the current pandemic.
So does the government have benchmarks established as part of that plan that would see an end to federal mandates?
So I try to be very quick because you're very quick and fair. So I mentioned earlier, there are different indicators. I spoke about deaths, hospitalizations, cases, long COVID, economic, social, personal costs, and many others that I could mention.
Right. So, Minister, the question is, I think, fair. As you said, it's reasonable that Canadians just want a plan. When we're provided as Canadians with the solution, that was to get vaccinated. Canadians got vaccinated. When they were told to get boosters, they're getting boosters. They were told to wear masks, they're wearing masks. All they're asking for every single day is, what is it going to take for us to see the mandates end? So they're not necessarily asking that the mandates end today. They want to know what it will take for the mandates to end. So you talk about all of those epidemiological factors. What what is the number? And if you don't have the numbers today, Minister, I accept that, but will you undertake to come back to us by a certain date with a number that will then trigger an end to the mandates?
Well, I would be disappointing you if I were to promise I would come back to you with one number, because there are many different indicators, and that's what we look at, the broad range of indicators. It's sometimes called a dashboard. So we all know it's a bit complicated. It would be simpler if we had only one indicator, but we look at the range of possible benefits and costs to the different policies that we're using.
And again, Minister, I've listed a few things in my previous questions to you. All of those, the global picture in Canada of all of those different areas where you could set benchmarks, hospitalization, hospital capacity, wastewater surveillance reports, vaccination rates. Take a look at that whole picture, set a benchmark for each one, and once we've checked all those boxes, mandates will be lifted. Do we have those numbers, Minister?
I'll give you one number, 700,000. That's the estimate of the number of surgeries that have been either canceled or delayed because of COVID-19. We're not yet with the ability in the current hospital capacity to catch up with that backlog. In many provinces and territories, we're still hospitalizing and looking after too many COVID-19 patients to try to start recovering from the backlog that we have seen over the last few months.
So I'm going to follow up on that question because I don't want to spin my wheels on the last one too much longer. We know that a 20% reduction in cancer, that we saw a 20% reduction in cancer screenings during COVID, and that half of patients had cancer screenings and care appointments canceled or postponed, and a 4-week delay in treatment, we'll see a 10% increase in death. So does the government have a plan for 2022, for this year, to address the backlog of cancer screenings and treatments that has been caused by COVID-19?
Yes, and all the associated personal and family costs that this comes with. I'm an economist, so I use numbers quite a lot. But behind numbers, there are people, lives, and families. So it's not an abstract thing when we recognize the cost of COVID-19. So that's why we need to keep working together to make sure that the policies that we're going to keep assessing and will keep evolving will be policies based on outcomes for real people.
Thank you, Minister. Thank you, Mr. Barrett. Next, Dr. Pawlowski, please, for 5 minutes.
If I may, I will ask my question to Dr. Tam. Now, the Progressive Conservatives would like a date on which we're going to lift the mandates. I think they figure that we're going to base this on some arbitrary decision, like my mother's birthday, or maybe Mr. Duclos' wife's birthday, or Fidel Castro's birthday, or something like that.
Just a point of order, Chair. I'm just wondering if Dr. Pawlowski is speaking about provincial progressive conservatives or progressive conservatives in a provincial legislature, because in the House of Commons, there's only one Conservative Party, and it's the Conservative Party of Canada.
Sorry for that interruption.
And we certainly realize you're not progressive. Now, I think some in Mr. Barrett, to give him credit, he wasn't asking for a date. He was asking us for benchmarks on which we were going to base our decisions. Now, I'm pretty sure that we aren't making our decisions arbitrarily as when we're going to drop the mandates. I think it's obviously based on complicated things, on modeling. And even though I too have a master's of public health, I don't even understand things like regression analysis and how they work. But I think the Canadian public wants to, and I think we all want, that the government is basing its decision on something other than dumbing it down, because in Parliament that's what we do. We dumb it down. But I don't think we want our policy decisions with respect to health in the pandemic to be dumbed down. So I'd like to give you an opportunity in a couple of minutes to explain, and I want you to explain in a technical fashion, because I think that's what we base our decisions on. So maybe, and there's some of us in this room who are doctors, can you explain it and feel free to maybe go over our heads in describing what is modeling and when you're doing the modeling, what's it based on? Presumably on case rates, presumably based on hospital admissions, ICU admissions. So just give us a bit of the hard science on this, please.
Thank you for that question. So, Mr. Chair, as you have many who watch the media briefings or the press conferences will know that we've been providing modeling information on a regular basis. There are different types of models. There are there are ones which really are the longer term, but only good for, let's say, within a month time frame, where we input through surveillance and epidemiologic data some forecasting on the case trajectory, but also on hospitalizations as well as projections on mortality. So those are important if you were thinking about adjusting policies. Are the cases going up? How fast they're going up? Are they coming down? And by what rate? And what the impacts might be. And our last modeling certainly would suggest that with the lifting of provincial public health measures, some resurgence, particularly in the context of a very highly transmissible variant, could resurge. So we are watching that very carefully right now because the cases are plateauing as they are coming down and maybe at a point of resurgence. So we do want to know that the hospitals are not being impacted as that resurgence occur, and in feeding into some of the federal decisions. We also have other types of models, and that really are used for planning purposes and inputs a number of variables that includes vaccine uptake and vaccine effectiveness, and doesn't as yet include waning immunity. But all of those models tell us something about how we should strengthen booster doses, but also looking forward to the timing of those and what might happen in terms of provision of those models into the slightly medium and longer term. But I think vaccine effectiveness, uptake, and all of that is taken into account as well. And then there's the international epidemiology, which, as many people have seen, there's a resurgence of cases in many areas of the world at the moment.
Can you tell me then, when you do the modeling and you're making your decisions about things like mandates, the primary thing you want to avoid is hospitalizations, deaths, ICU admissions. Is that what basically determines policy in terms of when you're going to bring an end to the mandates?
Short answer, if you can, please, Dr. Tam.
Well, I think that absolutely, but policymakers also need data on the effectiveness on reducing transmission and infection, on top of severity, and on top of trajectories on vaccine uptake as well, and what difference a mandate might make.
Thank you, Dr. Tam. Dr. Pelosi. Next, Dr. Ellis, please, for 5 minutes.
And thank you to our guests here today answering these difficult questions. Through the chair to the Minister of Mental Health and Addictions, ma'am, are you aware of the unregulated sale of cannabis on reserves, especially in Nova Scotia?
Of course, that would be Minister Haiju who will deal with that through First Nations Inuit Health Branch in terms of what they are trying to do in terms of keeping people well. But on First Nations, it is about the First Nations leadership having governance for themselves and often policing. So I think. If you have a concern about that, then please let us know, and we'll respond.
Oh, great! Thank you, Minister, for that. I appreciate it. Through you, Chair, to the Minister of Health, We've talked a bit about mandates here today, extensively actually. Curious to know, there doesn't seem to be an answer with the mandated nature of a third shot for COVID. Is that in the works?
Well, there are two angles to that. First, about the connection between policy and the vaccination status, and second, the value of vaccination status around a third dose. And if you want, we can turn to Dr. Tam for evidence on that.
No, that's okay, sir. Thank you for that. Question for you, sir, again, through the chair, if you would. Prior to the pandemic, it's very clear that hospitals in Canada, both in my home province of Nova Scotia and certainly here in Ontario, have functioned between 90 and 130% capacity. And we've heard previously from some witnesses here that the mandates will continue until hospitals are not affected. You're an economist, sir. I wonder how mathematically that's actually possible.
Je vais le dire en français parce que ça va être un petit peu plus précis.
Perhaps I can be more specific speaking French. Of course, there's no specific hope of returning to a system that wouldn't take care of people who are affected by COVID-19. I'll give you an example. In Quebec, however, a few weeks ago, due to the large number of hospitalizations, there was an 80% rate of usual surgeries no longer being possible because of the rate of hospitalizations due to COVID-19.
Thank you, sir. Through you, Mr. Chair. Interesting question. We've talked a lot about COVID and the effect it's had on our communities. We also know, sir, that the measles is an illness which is very deadly, very contagious. So is there a question here, can Canadians expect childhood vaccines to be mandated in the future, sir?
Well, that's an excellent question. We might all benefit, including myself possibly, to turning to the Deputy Minister, perhaps even Dr. Tam, although I'm not, I think Dr. Tam would be well equipped to answer that question around measles and the vaccination strategy.
Over to you, Teresa.
Yes, so measles is a very contagious childhood disease, but the vaccines are very effective to the extent that elimination of measles is now a global priority. And it is really important for people to keep up to date with the vaccination, which may have been delayed due to COVID itself. So it's really important to catch up. The provinces and territories are, in fact, responsible for any of those vaccine policies. In Canada, there's no specific mandating of measles vaccination, but there's jurisdictions vary in their requirements, but some require the provision of measles vaccination status for school entry, for example, but that is not within the federal jurisdiction.
Thank you for that, Dr. Tam. One final question for the Minister of Health, if I may. Sir, just to be clear for Canadians, is there a plan, simple answer, sir, yes or no, for the ending of federal mandates?
Well, again, that depends what we mean by mandates. There are mask mandates, there are vaccination mandates, testing mandates.
Sir, just the federal ones.
Well, there is a large range of different policies and mandates. So I would be dishonest, and I don't think you would appreciate that if I were to give you a yes or no answer.
Sorry, sir. Just is there a plan for the ending of federal mandates? I guess that's the question.
Which mandate do you have?
All of them, sir.
All of them.
Is there a plan in the works?
Well, I think it would be irresponsible to say yes or no. No, I think we need to be responsible means that you need to follow the evidence, the science, and the precautionary principle, and adjust and analyze the policies as things evolve.
Thank you, Minister. Thank you, Dr. Ellis. Suite Madame Brière pour 5 minutes, s'il vous plaît.
Ms. Brière, 5 minutes. Thank you, Mr. Chairman. Thank you to the ministers. My question is for the Minister of Health. Of course, we are all very much looking forward to getting back to sort of normal life without COVID, and to a large extent that involves the ability to travel throughout the world and also to welcome foreign travelers and family and friends who live abroad. Can you tell us a little bit about the April 1st measures for border controls that will be entering into force shortly? Certainly, with pleasure. The reason why this is possible is because the infection rate for COVID-19 is dropping. It's not quite at the level that we expect it will be at in the coming weeks, but it's getting there. And that's the case because it's not a magical fact. It's because people have actually followed public health measures and been vaccinated. This has reduced the level of infection, transmission, and hospitalization. As of April 1st, the good news is that for people who want to travel in Canada, there will no longer be a required test to get into the country, but there will be random testing that will be administered at the border when people return to the country to specifically validate the number of people coming back to the country with COVID, and second, to see if any new variants might be entering the country, and three, it'll give us an idea of which countries we should perhaps track more closely to have a better idea of where to focus our resources. Are there variants tending to come from certain countries more so than others, and to what extent? Thank you. On another note, we know that Alzheimer's disease is the most frequent form of dementia in Canada. And the people that are living with Alzheimer's, of course, experience incredible negative effects, and family members all the more so. I'm experiencing this myself. My mother-in-law has had Alzheimer's for the last 2.5 years. It's changed her life, of course, tremendously. My father-in-law's, her husband's life, and of course our lives as well. There's been an increase in the number of cases of Alzheimer's among people 65 and over. Can you tell us, Minister, what we are doing to support people who have Alzheimer's and other forms of dementia? Elizabeth, it's really important to recognize this. The aging population is a good thing. I mean, we are aging. There tend to be more Canadians aging and in better health. But of course, we're also seeing an increase in rates of dementia, and you've experienced it. I've experienced it among family members. About 450,000 Canadians 65 and over are currently living with some form of dementia, whether it be Alzheimer's or other diseases. Since June 2001, we've had investments of $212 million over a period of 12 years. We could ask Dr. Strom to give us perhaps more explicit details as to this strategy. We've been working on finding ways to combat dementia, but also to care for people experiencing dementia and taking care of those close family members and caregivers who are there to support and love people who have dementia. Thank you.
Minister, and thank you for the question. I'm happy to answer if you request it.
1 minute? Okay.
Oui, allez-y.
So, Minister.
I think Dr. Strong is going to just
okay.
answer your question.
C'est votre choix.
It's up to you. No, go ahead.
Dr. Strong.
Yes, thank you for the question. We do have an integrated dementia research strategy in the country, both by ourselves working with Public Health Agency, our Institute of Aging, and with a number of research groups across the country, looking at everything from how do we improve healthcare for individuals who are afflicted by Alzheimer's disease, as you've indicated, for their family members and such, but also very robust programs looking at underlying causes. And particularly as we move forward as well, evidence that's already suggesting that we may see earlier presentation of a number of the diseases because of long COVID. So very active research area. Happy to comment further at any time.
Merci, Madame Brière.
Thank you, Ms. Brière. Mr. Thériault.
To me.
2.5 minutes. Thank you, Mr. Chairman. Minister, in the Health Canada ministerial plan, or departmental plan rather, for 22-23, it says that Health Canada has to develop policies or support that following independent research on mental health issues for the people affected by mental health issues. Have you received a report from these independent experts? And If that is the case, when would you make that public? Because time is of the essence. It might also inspire the joint committee that hasn't yet sat since the elections, actually. Thank you for the question. It's very important to us. To understand and to hear from experts. It's important to understand from people who are experiencing things like this. It's important to have a strategy for mental health that are Canada-wide. I'm also working with my counterparts in the provinces and territories. This is very important. With the CAIHA experts like Dr. Strong and Dr. Weiss, who is the head of the Mental Health Institute, he is so involved in all of our work. Actually, my question was specific. There was an independent committee that was struck at the same time as the joint committee on medical assistance in dying. Did you receive the expert reports from this independent committee? If so, when will you make that public?
Medical assistance in dying.
Two things on that point. And on the second point, to get more specifics, I'll turn to the Deputy Minister first. The Standing Committee has some work to do, and we'll be there to support the committee in the way that it needs and requires. Now, the second part, where we're at in terms of the external committee. Deputy Minister Lucas, do you have anything to add to this? The committee is continuing to undertake its study. It's almost done. We can expect their report in the coming weeks, soon. Thank you, Mr. Thériault.
For today will be Mr. Bachrach for 2.5 minutes.
Thank you, Mr. Chair. Dr. Tam, there's now considerable data, including data from the CDC, that shows that those who have been infected with COVID-19 and have recovered are at least as protected, if not better protected, from infection, serious disease, and death compared to those vaccinated with mRNA vaccines. This is a question that several constituents have asked me, and I'm curious what the answer is. Why don't we recognize the protection conferred by infection-acquired immunity in Canadian COVID-19 policy?
Thank you for the question, and Mr. Chair, this is an area of ongoing scientific studies, and variants actually also differ in the amount of immunity that they confer. And for example, we do know that those who just got the infection and hasn't been vaccinated are not as well protected as those who got 2 doses of vaccine, for example, and then subsequently gets an infection. The Omicron virus variant is also under study at the moment. And there's certainly some preliminary data that shows that the immunity conferred by this variant is variable between different people. And so that is why the National Advisory Committee on Immunization still essentially recommends vaccination even if you got COVID-19 or if you think you got infected after a suitable time period, depending on whether you're looking at the primary series or a booster dose. For example, those who got infected just recently can wait 3 months before getting their booster shot because of this variability that we're seeing in infection-conferred immunity.
Thank you, Dr. Tam. And if I may, I'm going to try to squeeze in a question for Minister Duclos. As you probably know, Dr. David Naylor, the co-chair of the Federal COVID-19 Immunity Task Force and former chair of the Federal Review of the SARS epidemic has called for a public inquiry into Canada's COVID-19 response so that, quote, we can actually get a dispassionate review. He's calling for it to be led by international experts. Will you make a firm commitment to launching an independent public inquiry into Canada's COVID-19 response?
Well, I'm glad that you mentioned Mr. Naylor. He's been a very important ally and expert as we have gone through the last 2 years of the pandemic. In fact, we speak to each other or we meet with other experts and himself quite regularly. So we are obviously doing this on a regular, continuing basis. How we will assess eventually the lessons through COVID-19 more formally in a more open environment is yet to be determined, but we'll be looking forward to your views and that those of your colleagues to do that in the right manner.
Thank you, Mr. Chair.
Okay, thank you, Mr. Bachrach. Mr. Lake has asked for an accommodation. He's asked for 10 seconds, and I'm going to give it to him.
10 seconds to make the point I was trying to make earlier. The Minister Bennett mentioned the serious consequences for the Sacklers and Purdue Pharma. I would like her to table with the committee what were the serious consequences imposed by the Canadian government on the Sacklers and Purdue Pharma.
You able to do that, Minister?
I will sure try.
Thank you. Minister Bennett, Minister Duclos, thank you so much for being here with us for an extended meeting. We certainly appreciate all the work that you do and your patience with us today. And also to those who are with us virtually, I offer the exact same thanks and gratitude to you for all of your work and for being with us here today. To all of our witnesses who are with us, you're welcome to stay, but you're free to leave. To the members of Parliament, please stay put. We now have to consider the estimates and consider some standard motions that come with the presentation of the estimates. So thanks again, ministers and witnesses. With respect to the supplementary estimates, is it the wish of the committee to vote now on the supplementary estimates? Okay. In all, there are 7 votes in the supplementary estimates, 21-22. Unless anyone objects, I think I have a suggestion that we group them together for a decision. Is there unanimous consent to proceed in this fashion? I see consensus in the room. Shall all votes referred to the committee in the supplementary estimates 21-22 carry? On division, shall I report the votes back to the House? Thank you. Okay. So we don't have to go through now. With respect to the mains, are we ready now to vote on the mains? In all, there are 11 votes in the mains for the fiscal year ending March 31, 2023. Unless anyone objects, I will seek unanimous consent of the committee to group the votes together for a decision. Is there unanimous consent to proceed in this fashion? Shall the votes referred to the committee for the main estimates 22-23 carry? Carried on division. Shall I report the main estimates 2022-2023 to the House? Yes. Very good. Is it the will of the committee that we now adjourn? Yes. We have consensus. We are adjourned. Thanks, everyone.